This is Kathy Grace. Hello, this is Kathy Grace, co-director of the Graduate Center for the Study of Early Learning, and it's so nice to be back with you for our Wednesday conversation series. Today, we're very fortunate to have a longtime supporter of early care and education, children in this state, and good friend of mine, Dr. Linda Southward. Linda is the Executive Director of the Children's Foundation of Mississippi, and Linda, we're so glad to have you with us today.
Thank you, Kathy. It's always a great opportunity to be with you and to talk about how we can improve outcomes for children in Mississippi. Thank you.
Now, your foundation is relatively new, so could you just talk a little bit about the formation of the foundation, your mission, and what you have set forth, and very ambitious goals that you've set forth for yourself and the foundation?
Yes, well, thank you, Kathy, for that opportunity to talk a little about the Children's Foundation. The name itself was very intentional. We put children at the front at the name of the foundation. So it's the Children's Foundation of Mississippi. And we really believe, and we say this quite often, but for Mississippi to reach its potential, we must make sure that our state's children reach their potential. We know that a strong start in childhood provides a sound and sturdy foundation for lifelong learning, better health, and future contributions to our communities. And so the Children's Foundation at its heart is really about policy and systems change on behalf of children all across the state. And it's important for us to think about young children because we're thinking about this also in terms of workforce for today and workforce for tomorrow, as often coined by the U.S. Chamber of Commerce Foundation.
Well, I know in that regard, you have been very busy with generating several reports all around, as you said, trying to focus us through data on different situations that our children and circumstances that our children are growing up in. And if you'd like to, I know there's so many of them, you're not going to be able to talk about all of them with us. But if you'd like to just talk about a few of them and how these fit together, but they also stand alone.
Exactly. Well, thanks, Kathy. So as we're saying, we were established in August of 2019. In January of 2020, the Mississippi Kids Count found itself as home within the Children's Foundation. So really, there's about 3 reports I'd like to talk about. One was a policy brief, which was our first one that was released in 2020, and then the other 2 were this year. So that first one was based on a survey, a random survey of Mississippians. So this is commissioned by the Children's Foundation. And because it was a random survey of Mississippi, we can universalize these findings, as you know, from a research perspective. And we found that there is a high level of support for early childhood policy improvements. Almost 4 in 5 Mississippians see early childhood spending as an investment that will pay off in the long run and also save the state money. And that was 79%. And then we also ask a question that's been asked on other surveys over a period of 10 to 12 years, and it's been consistently a high level of support for public state pre-kindergarten system. This one was even higher, 83%. Express support of that. And then we asked a couple of more questions. We asked Mississippians what they think about the importance of quality rating in early care and education. 95% surveyed expressed support. And then when we ask about the importance of children in entering child care and early education settings, about a wellness exam or a check before enrolling in child care centers. As you know, that's not required even for the school system. It's really more of an immunization record, I think maybe proof of your residence, et cetera. But anyway, Mississippians, 94% expressed support for that. And why is this important? Because when we think about a third of Mississippi's children live in poverty. As you know, Kathy, and we've talked about through the years and so many other people in this area, it really underscores so many unmet needs of children across the state.
Well, with the survey results and the fact that, as you said, this has not been just brand new news, but it has come across with stronger percentages of the general public endorsing early care and education programs, quality, all the things that we know would be best for our children. So if I understand correctly, that led to another report that you've been able to generate that was very specific to where you live and if your zip code does make a difference and that sort of thing. So maybe you want to tell us a little bit more about that particular brief.
Yes, exactly. And this one was really an in-depth analysis. It's called the Mississippi's Risk and Reach Report. And then the subtitle is Opportunities for Children, Youth, and Communities Across the State. Mississippi is only one of a handful of states that have done this report. And this was a product of our Mississippi Kids Count program, which I mentioned before is now housed within the Children's Foundation. And so this was based on some methodology developed by Tulane University several years ago. And we thought it would be really important for Mississippi that has some of the worst outcomes for children for many years to take a look at the 16 sort of like 4 domains with 16 indicators, and the 4 general areas are economic, and that's things like unemployment rate, percentage of children in food insecure counties, percentage of children living in poverty, et cetera. Then we took health, looking at some of the things that are part of that, percent of low birth weight babies, infant mortality rate, percent of uninsured children under 6, et cetera. And then education, we're looked at kindergarten readiness scores, a percentage of 3rd graders who were proficient in language arts and math, high school graduation rates, and then family and community, looking at things like percentage of children in single parent families, rates of child abuse and neglect, et cetera. So that was all the risk. And then we also looked at the reach factors because we wanted to take a look to see, okay, well, these are the risks, then what really is going on within the county? So for example, if you take health, where are the home visiting programs in the state? Where are the pediatricians? Where are the school nurses? And so putting all that together, and we contracted this back to the Social Science Research Center at Mississippi State to do the analysis, we found that in Mississippi, about 1 in 10 children live in high-risk counties, 11%, 26% in moderate to high-risk counties. So you put those together, you're already more than 1/3 of children living in high-risk counties or moderate to high risk. And then 37% live in moderate to low risk counties, and 25% live in low risk counties. So basically, only 1 in 4 children in Mississippi live in counties in geographical areas where there is a higher probability based upon these specific risk factors. And we know that this isn't all, but these are the ones that we could make a comparison from county to county. In other words, from apples to apples or oranges to oranges. So that is really, it's really sobering in many ways, but it's also a way of looking at where you are in the state. And not only have we done this across the state in this risk and reach report, we also have on our website county level fact sheets. So anyone listed in from whatever county they are residing in Mississippi, or whatever county or counties they may have interest in, you can take a look at this and determine where things stand for children within your community. And most of these stats, which is common by the time the statistics, they are later than whatever the current year is, right? Because it takes a while to get this information, whether it's something like infant mortality rate from the health department to CDC, and then how this comes out. And so when we think about these, this was by and large statistics before COVID. And so we know that there's so many things was a result of COVID. For example, we know that a large percentage of children, not only in Mississippi, but across the country, did not have their regular well child visits, particularly in the first few months of COVID. And that's important because when you think about, as you well know, Kathy, if it's a child who's 18 months and their screening or well child visits have been postponed by 6 months or so, that's a third of the child's life. So we don't know, and this has been said on numerous occasions, we don't know what the impact long-term is really going to be from COVID in these risk factors, but we know what it was at the beginning of COVID and before, and it's not good. So we're thinking that it's not getting any better given the pandemic that we have gone through and are continuing to go through.
Well, with regard to the COVID response, and I'm thinking primarily about resources that are going to be made available to the state, every state, but specifically to our state, then I guess I would ask you to talk about the next phase of the three-pronged approach, which is your blueprint from the foundation's perspective. And to me, during this period of time, when we've always said, well, if we only had the money, we would do this, this, this. Well, now we can't say if we only had the money. So that in one regard is a great piece of news. But the other part that concerns me is the wisdom that will be required so that we can leverage the dollars we have and to be really measured in our decisions on what we do and how we are ensuring that some of these elements that you've already discussed can be addressed and that there is a real systems change so that children have greater access to some of the things you've already discovered that they were lacking even before COVID.
Exactly. And it is so true. It's just unprecedented amount of funding that is coming, as you said, to states across the country. And I think when we look at the ongoing poverty rate of children in Mississippi and what we talked about, the only 1 in 4 children live in a county that's considered low risk compared to the children who are in high risk counties. It is a huge opportunity to be able to have some intentional, strategic, long-term thinking that is going to be required in order to make systems change so that down the road, we can look back and say in 2021 or in 2022, this is when we began turning the curve for children in this state. So the third report that you mentioned about the blueprint, it was released in June of 2021. So it was based upon the information we've already shared, but also we collected additional data, interviewed many leaders across the state, had some additional surveys, looked at some extant secondary data and we asked people not only how they see Mississippi to other states, but most importantly, what do they see are the most important issues to work on? And then what are the areas where changes are the most feasible? And so we took all of that together because look, there's so many areas that we could go on, and if we spread ourselves too thin, we're not going to be effective on many or any of the issues, but trying to be more focused. So we came up really with 4 based upon, again, what people from the interviews, from the analysis, et cetera. And it's really looking at increasing developmental screening to recognize healthy development of children as a necessary first step to a bright future. And that's part of the system work, Kathy. You're talking about the referrals, the intervention, the follow-ups, to really have a system in place and not just parts of a system. And then the second one is increase the quality of early care and education in Mississippi. And that really is about building skills for success in life. I mentioned earlier about the workforce component, and it really is, as we've talked about numerous times times over the many years is it's an economic issue. And then obviously the digital divide, trying to accelerate that momentum for some transformation there. And then a state-based earned income tax credit to really lift working families out of poverty. We know there's too many families in this state and across the country who are working full-time but do not have a living wage, if you will. And so parents, teachers, many people are working more than one job to support their families and children. So at our board meeting a couple of months ago, the Children's Foundation board of those four decided to really focus in on the first two, increasing developmental screening and increasing the quality of early care and education in Mississippi, and then to partner with other groups who are working and have been working on the digital divide and earned income tax credit. And in this blueprint, each of those sections are really standalone pieces. It was set up that way. But then when you look at it as a whole, and what we've said in the blueprint is that we really liken this blueprint to a GPS to really kind of guide our efforts. I mean, how many times do we just punch in the address and where we want to go in our vehicle or our maps or whatever? So we just really see this as sort of a way to chart a best course forward from the perspective of the Children's Foundation and really to improve outcomes for Mississippi's children. And so coming from that, there will be a series of specific policy briefs. And the first couple are coming out later this fall, by the end of the year, to really take a look at developmental screening and to look at some areas that Mississippi can improve on to really help our youngest, our babies and our toddlers, and as children go, as you know, the first 1,000 days and the first 3,000 days of a child's life are so important. So really helping increase the percentage of children who receive developmental screening in Mississippi. And sadly, right now, it's about 1 out of every 3 children who receive developmental screenings using a recognized instrument. So that's where the Children's Foundation, we started, as I said, in August of 2019, and knew that we needed to have specific plans and specific focus on our work. I mentioned the blueprint, and it is primarily for children 0 through 8. We are also working on phase 2 of a blueprint. I'd like to pitch out there for children 9 through 18. And that phase 2 of the blueprint will also have 4 topics, as this one does, but 4 different topics. And it will be released sometime next spring. And the 4 topics for the older children and youth will be on child protective services, access to mental health services, comprehensive health education, particularly around nutrition, and then life skills and post-graduation preparedness.
Well, when you mentioned about nutrition, I had to just reflect on what the latest news was about Mississippi and juvenile diabetes, and how that has become quite a crisis situation affecting young children like 7 and 8 years of age, and how there's going to be more focus, we hope, around how to do some prevention and education, re-education on how to help our children, particularly in certain counties, back to counties, where this seems to be more of a problem than in other locations.
Kathy, you're exactly right. And I've read some of the studies that have come out. And one of the things that is very sobering is when physicians talk about how rare, I mean, it used to be such a rare thing to have what was called adult onset diabetes. I don't think they call it anymore, I think type 2, but they're seeing it younger and younger children. And that has so many implications for negative outcomes for children.
Well, and how costly it is as children grow into adults with regard to other health problems like kidney failure or problems with vision or circulation, and it just goes on and on. And that gets back to workforce. And if you're not physically fit, then you're not able to hold a job. And so here we go again about the importance of the early years and how it does play out over life. It is a lifelong impact, not just cognitively, but in so many other areas as well. You mentioned about a lot of this information was prior to COVID, and that it's assumed, and of course we have the data to back up some of it, that some of the services may even be less likely to be available in some of the counties. I do think that one thing that may be a positive, and you mentioned the broadband issues or the issues about lack of internet services. I think that perhaps because children were out of school last year and there was an attempt made to try to establish hotspots or to increase that capability, that's a positive. But I also realize now that there's still areas in the state where that did not occur. So it's actually been more of an issue now where there a definite gap in the have-nots versus the haves as far as internet access. And so I hope that the state, and I'm sure that, again, back to the county level, they'll have to continue to work on opening up more opportunities for children and for adult students here at the university who were having to be outside in their driveways to be able to take a course. Because that was the only way that they could get reception. And again, this affects not only the public school children, but also our college students as well with regard to access. I want to thank you so much for bringing up so many of these things that you have already alluded to and talked about. And you've been doing this for some time, not just with the foundation, but with some other experiences. And I will say that years and years ago, one of our state economists said to me, you know, the richest resource we have in Mississippi is data, and we are historically not utilizing this great resource that for whatever reason, information people like you have generated over the time is not necessarily what comes to the table when we make decisions. And would you have any thoughts or any suggestions, ideas, how to get more conversations around the data as we were looking at planning? So if I would say to you, Linda, where do you think we'll be 5 years from now? What would be your response, knowing a lot more than most people about the conditions that are factual? They're not somebody's opinion, they're not somebody's supposition or stereotypic response, but from the fact standpoint, where do you think we'll be 5 years from now?
Well, my answer to that is it depends. We can talk about where the Children's Foundation and so many of us who've been in this for a number of decades. It depends. It depends on what the state and communities are willing to invest on behalf of children. You're talking about an economist. We were delighted that Darren Well, the former state economist for Mississippi, wrote the foreword to the Risk and Reach report. And I'll just since you brought that up, I'll just turn to kind of quote what he said, and then I'll come back to answer your question more specifically on the 5 years. He said, we could ignore the challenges we face. We could exaggerate every positive trend while downplaying the negatives in hopes that our perception will become the reality. But if we follow that plan, we will still be wondering how to get our state off the bottom 20 years from now. Or alternatively, he says, we can use our small community to take advantage, the community of Mississippi as a whole, I think, and then also within communities. We can come together and celebrate successes, while talking honestly about challenges which remain and how to navigate the challenges which lie ahead. And he said something very complimentary of the Risk and Reach report. And he said, if this approach appeals to you, then the report will be helpful. So since the Risk and Reach report, as we just talked about, the blueprint. So back to your question, what do we see this 5 years from now? It depends on what people are willing to do, to have, as Darren Webb said, to look at this honestly. And we know from the data, we know from the research, we know from the successes of other states, we know from the successes in Mississippi, for example, the pre-K collaboratives. And we know about the increase in scores for kindergarten readiness. With the small number across the state who have been able to participate in that because of the funding. It's very laudable that the legislature doubled that funding last year, but we still know that probably that's going to serve about 6,000 of the 38,000 4-year-olds in Mississippi. Not to say that Head Start is not serving children, and there's children in childcare as well. But when you think about what the state is willing to invest, that is a demonstrated return on investment, as we said earlier, not just for today, but for tomorrow. So what can people do? I think people can take a look at this information, can look to see where they are in their counties, to have people come together, speak with your legislature, speak with your community leaders, bring in private, public, philanthropy to see what are some of the most important questions. And so we really, based on the data, have the opportunity to help guide and give feedback. And if there's anyone listening in the audience who wants to know more about what the Children's Foundation can do as a facilitator, we'll be more than happy to come to your community to provide data, to provide information. But the key is getting to children earlier. And Kathy, you've been advocating that for decades as well. And we know the science, the research, et cetera. And to be able to get this information out here and to look at it as a long-term approach investment. And if we do those things, I'm going to be really happy and I'll be happy because I will know that things are changing in a very positive way for children in Mississippi. If it doesn't happen, then that's on that. I think we all have a responsibility, and who doesn't want to have better outcomes for children in this state? We just must. It's an imperative that we do.
Well, I thank you so much for spending this time with us today and giving me a lot to think about. And I'm sure those listeners will go back and maybe consider going on your website to read some of these reports that we've mentioned. Could you just tell us real quickly how to get that online?
Sure. It's childrensfoundationms.org. Childrensfoundationms.org. Yes. Thank you.
Well, and again, thank you so much. And as we move through the legislative session, starting in January, we may come back and visit with you again to let you respond to other reports that will have been generated by then and what the temperature is in Jackson, legislatively speaking.
Yeah, we would love to do that. So yes, the temperature or the pulse, because I really do believe that people want to do the best about children. We have the tools and we have the opportunity. And now with so much of the federal dollars, we have unprecedented funding to do better for our children.
Well, thank you again. And thanks everybody for tuning in. So Dr. Linda Southward, we appreciate you so much. Thank you.
Thank you.